Self-harm impacts many of us and our loved ones. It's often caused by emotional stress or mental suffering. Based on research looking at self-harm as a global issue, for every suicide death each year, there are around 20 cases of self-harm. In this video, we help you understand more about self-harm. We share evidence on what self-harm looks like, who's affected, and how treatment and support can help. Hi, I'm Dr. David Goldblum. I'm a psychiatrist, and I'm here at CAMH, also known as the Centre for Addiction and Mental Health, which is Canada's largest mental health and substance use teaching hospital. In this series, we're exploring the top mental health questions on the internet. So make sure to subscribe to our channel and turn on the notification bell to stay informed. First, what is self-harm? Self-harm is when you injure your own body on purpose. It's different from suicidal behavior when you intend to die from suicide. Self-harm can look like cutting, burning, biting or hitting yourself, or preventing wounds from healing. It can also include poisoning, where you take too much of a drug or an unsafe substance. Though some people need support for both suicidal thinking and self-harm, healthcare professionals consider these separate concerns. How is self-harm diagnosed? It can be hard to recognize when people are self-harming. The signs are often hidden on parts of the body like the forearms or thighs, areas that are often less visible or usually covered by clothing. Self-harm is a behavior rather than a condition that can be diagnosed, and it can be observed by anyone, friends, families, or teachers. However, if there is a diagnosis underlying the behavior, then that can be made by a physician or a mental health professional. What increases the risk of self-harm? Self-harm can't be prevented in the same way that as some infectious diseases are. So instead, we talk about risk factors. What increases the risk of self-harm? There isn't a single cause for self-harm. Multiple emotional, environmental, physical, and social factors can raise the risk of self-harm. The causes and risk factors for self-harm are complicated. Some are social or situational, like a difficult time at home or at school, a breakup or falling out with friends, or dealing with discrimination due to race, ethnicity, sexual orientation, or gender identity. Other risk factors are more enduring, like feeling empty or isolated, feelings of anger, anxiety, or depression, or a history of trauma or abuse. Having other mental health challenges can add to the risk of self-harm. For example, other mental health concerns including depression, borderline personality disorder, and alcohol or drug use are often connected with self-harm. Physical illness and witnessing or experiencing violence are also risk factors. There are usually strong emotions involved with self-harm. People who self-harm may see it as a way to get rid of bad feelings or to stop feeling numb. Some people might use self-harm as a way to punish themselves or instead of acting on other urges. Some people experience an immediate sense of relief after self-harm, but then feel worse afterward. Sometimes self-harm is motivated by the need to express difficult feelings or as an indirect plea for help. Teens have higher rates of self-harm than other age groups. Older adults are also at increased risk for some types of self-harm. According to recent research, older adults, more than other age groups, are more likely to take too much of a drug or unsafe substance may be due to their increased access to medication. Self-harm is a behavior, not a condition. So when we're discussing treatment, it relates to the possible underlying condition, like borderline personality disorder, for example. However, there is hope. Mental health professionals use different therapies or approaches to help people who self-harm. Some of the psychotherapies that have been used to successfully treat people who self-harm are called cognitive behavioral therapy, dialectical behavior therapy, and motivational interviewing. For example, cognitive behavioral therapy can help people develop healthier coping strategies when stress occurs. It can also help people change negative thinking styles that may lead to self-harm. Dialectical behavior therapy can help people be more mindful and improve how they regulate or manage their emotions. Reaching out to a healthcare professional is an important step. Any treatment for self-harm must begin with an assessment by a trained mental health care professional. To improve the chances of successful treatment, people looking for help for self-harm should be thoroughly assessed for suicide risk and other mental health conditions like depression and borderline personality disorder. How else can we help someone who is self-harming? Well, along with treatment from a mental health professional, friends, loved ones, or community members can offer emotional support by listening to and talking about the emotions that lead to self-harm. If you know a person who is at risk of self-harm, you can take practical steps, such as keeping harmful materials that could be used for self-harm, such as sharp objects or medications, out of their way. It may also be worth thinking about limiting access to social media sites that show videos promoting self-harm. If someone confides in you, listen calmly and be as non-judgmental as possible. This might encourage them to reach out to you again. Self-harm can be hard to recognize or understand. However, with the right information and support, people who self-harm can be supported and treated. Please visit the resources available in the description, including the new Canada-wide crisis line 988, which provides free support for anyone who is thinking about suicide, in emotional distress, experiencing self-harm, or who is worried about someone they know. I'm Dr. David Goldblum. Did you like this video? Subscribe to our channel for more evidence-based insights on mental health and substance use.